White judge finds black woman only to learn. She's a public health official, Part 1. The courtroom felt cold that Tuesday morning. Judge Robert Mills sat high on his bench, looking down at the day's cases. His gray hair and serious face showed his 20 years as a judge. He was known for being strict and fair. The clock on the wall showed 9 o'clock. Emma Wilson rushed into the courtroom, still wearing her hospital ID badge. She had come straight from her night shift. Her dark curly hair was tied back and worry lines showed on her face. She was late for her court time, and Judge Mills did not like lateness. Case number 47, Emma Wilson, expired car registration, called out the court clerk. Emma walked forward, clutching her folder of papers. Her hands shook slightly. She had meant to renew her registration, but between her work and caring for her son James, it had simply slipped her mind. Ms. Wilson, you are charged with driving with an expired registration for 3 months. How do you plead? Judge Mills asked in his deep voice. Guilty, Your Honor, but I would like to explain, Emma said. Judge Mills looked at his watch. He had 20 more cases to hear that morning. Go ahead, but please be brief. Emma took a deep breath. I'm a single mother working double shifts at County Hospital. My husband Tom died last year and I've been trying to keep up with everything. I simply forgot about the registration with everything else going on. The judge's face showed no emotion. He had heard many such stories before. People always had reasons for breaking the law. If he made exceptions, where would it end? The law doesn't care about your personal circumstances, Ms. Wilson. The fine is $300 due by the end of the month, he said, banging his gavel. Emma felt her heart sink. That was money she didn't have. It meant no new shoes for James and cutting back on groceries again. Maybe she could pick up another shift, but she was already working 70 hours a week. But, Your Honor, I'm asking for a bit more time, or perhaps community service instead? She asked. Judge Mills shook his head. The fine stands as stated. Next case. As Emma turned to leave, she looked directly at the judge. Their eyes met for a moment. You have no idea what people are going through, she said softly but loud enough for him to hear. The courtroom went quiet. Judge Mills could have charged her with disrespect, but something in her tired eyes stopped him. He simply nodded to the clerk to continue. Emma walked out of the courtroom with her head high but her spirit low. She would find a way to pay that fine. She always found a way. As she walked to her car, she thought about her patients waiting for her at the hospital. At least there she could make a difference. Judge Mills continued through his morning cases, but Emma's words stayed with him. By lunchtime, he had forgotten her name but not her words. He ate his sandwich alone in his chambers, looking at a photo of his own family on his desk. When had he stopped seeing the people behind the cases? When had the law become just about rules and not about people? He didn't know that in 2 weeks, their paths would cross again in a very different setting. He didn't know that this small case, one of thousands he had heard, would change how he saw his role as a judge forever. White judge finds black woman only to learn. She's a public health official, Part 2. 2 weeks passed since that day in court. Judge Mills woke up feeling unwell. His head hurt and his chest felt tight. His wife Mary had been telling him to see a doctor for months. Today was finally his appointment at County Hospital. The waiting room was busy when he arrived. People of all ages sat in plastic chairs, some looking sick, others just tired. Judge Mills gave his name at the front desk and sat down with a magazine. He didn't like hospitals. They reminded him that even judges got old and sick. Mr. Mills called. A nurse. After 30 minutes, he followed her down a long hallway. The doctor will be with you shortly, she said, leaving him in a small room with a bed and medical posters on the walls. Judge Mills sat on the edge of the bed, feeling out of place without his black robe. Here, he was just another patient. The door opened and he looked up, expecting a doctor he'd never met. Instead, he saw a familiar face. It was the woman from his courtroom, Emma Wilson. But now she wore a white coat with Dr. Emma Wilson, Director of Public Health, on her name tag. Their eyes met, and he saw recognition flash across her face. For a moment, neither spoke. The power balance had shifted in this small room. "Good morning, Mr. Mills. I'm Dr. Wilson," she said professionally, looking at his chart. "I'll be examining you today." Judge Mills felt his face grow warm. "You're a doctor? I didn't realize when you were in my courtroom." "Yes, I am," she said simply. "Could you please roll up your sleeve? I need to check your blood pressure." He did as asked, feeling strangely like he was the one being judged now. Her hands were gentle but firm as she wrapped the pressure cuff around his arm. The machine beeped. "Your blood pressure is quite high," she said, writing numbers on his chart. "Have you been under stress lately?" Judge Mills almost laughed. Stress? His job was making decisions that changed people's lives every day. Of course he was under stress. Work is always stressful, he admitted, but maybe more so lately. Dr. Wilson listened to his heart with her stethoscope. "Take a deep breath, please," she instructed. Her face showed no sign of their previous meeting, no hint of anger or revenge. She was simply doing her job, and doing it well. "Your heart is racing," she said. "How much sleep do you get?" 5, maybe 6 hours, he answered. "I bring work home." As she continued the examination, Judge Mills couldn't help but think about their courtroom meeting. He had dismissed her so easily that day, seeing only a person who broke the rules, not a doctor who saved lives. "Dr. Wilson," he said finally, "about the fine I gave you." She looked up from her writing. "This isn't the place to discuss that." "Mr. Mills." "No, I suppose not," he agreed, feeling properly chastised. She finished her examination and sat on a stool, facing him. "You need to make some changes. Your body is showing signs of serious stress. I'm going to prescribe medicine for your blood pressure, but you also need rest and exercise." Judge Mills nodded, suddenly seeing how tired she looked. Was she working another double shift today? How many patients would she see after him? "Thank you, Dr. Wilson," he said sincerely. As he left the examination room, Judge Mills felt something he hadn't felt in years. Shame. He had judged her without knowing her story. In his courtroom, she was just another case number. But here, in her world, he saw the real person. A skilled doctor, overworked and underappreciated, yet still treating him with respect he wasn't sure he deserved. He decided then that he would find a way to make things right. White judge finds black woman, only to learn she's a public health official, Part 3. A week after his hospital visit, Judge Mills sat in his office looking at the file on his desk. It was Emma Wilson's case. He had pulled it that morning, something he rarely did with closed cases. The fine hadn't been paid yet. The deadline was in 10 days. The phone on his desk rang. It was his secretary, Linda. "Judge, your wife called. She wanted to remind you about your follow-up appointment at the hospital this afternoon." He thanked her and hung up. The follow-up. He had almost forgotten. Dr. Wilson would be checking his blood pressure again, seeing if the medicine was working. He felt nervous, like a schoolboy called to the principal's office. At 3 o'clock, Judge Mills sat again in the waiting room at County Hospital. This time, he watched the staff with new eyes. They moved quickly, always busy. A young nurse looked tired but still smiled at an old man in a wheelchair. Was this Emma's world, Mr. Mills? A different nurse called him this time. In the examination room, he waited only 5 minutes before Dr. Wilson entered. She looked even more tired than before. "Good afternoon," she said, checking his chart. "How are you feeling on the new medicine?" "Better," he said. "Less headaches." She nodded and took his blood pressure. As she worked, Judge Mills noticed a small photo pinned inside her white coat. It showed a young boy, maybe 10 years old, smiling with missing front teeth. "Your son?" he asked. She looked surprised but nodded. "Yes, that's James." "He looks happy," Judge Mills said. "He is. Children are good at being happy, even when things are hard." She wrote something on his chart. "Your blood pressure is still high but better. The medicine is helping." Judge Mills took a deep breath. "Dr. Wilson, I want to apologize for how I treated you in court. You didn't know I was a doctor, she finished, looking at him directly now. Would it have mattered? Should it matter? Her words hit him hard. She was right. Would he have treated her differently if he had known she was a doctor? Why should that change anything? No, he admitted, it shouldn't matter. And I'm not apologizing because you're a doctor. I'm apologizing because I didn't listen. I didn't consider that there might be more to your story. Dr. Wilson sat down on her stool, suddenly looking very tired. Do you know what my day was like when I got that ticket? I had worked 16 hours straight because we were short-staffed. A child died on my watch. I drove home crying. The next morning I found the ticket on my car. Judge Mills felt shame wash over him. I didn't know. No, one ever does, she said quietly. Everyone has a story, Judge Mills. Everyone is fighting battles you know nothing about. They sat in silence for a moment. Then Judge Mills asked, how do you do it? How do you care for so many people and still have anything left for yourself? And your son? Dr. Wilson looked thoughtful. Some days I don't. Some days I'm running on empty. She smiled sadly. But then I remember why I became a doctor. To help people. Even when it's hard. Especially when it's hard. Judge Mills realized that was why he had become a judge too, to help people, to make the world more fair. Somewhere along the way, he had forgotten that $350 fine, he said slowly. It's a lot of money for someone working double shifts to make ends meet. Dr. Wilson didn't answer. She didn't need to. I'd like to understand more, Judge Mills said, about the challenges people in our community face, the challenges you face as a public health director. She looked surprised. Why? Because I think I've been seeing only one side of the story for too long. Then white judge finds black woman, only to learn. She's a public health official, Part 4. The next day, Judge Mills called Dr. Wilson's office. Her secretary sounded surprised when he asked for a meeting outside of his medical care. This is about community matters, he explained, not my health. 2 days later, they met in the hospital cafeteria. Dr. Wilson wore her white coat, and Judge Mills felt strange in his normal clothes, not his judge's robe. They sat at a small table in the corner with cups of coffee. Thank you for meeting me, Judge Mills said. I've been thinking about what you said. Dr. Wilson nodded but waited for him to continue. I want to understand more about the challenges people face, the ones I don't see from my bench. He took a sip of his coffee. Would you be willing to show me? Dr. Wilson looked surprised. Show you what exactly? Your work, the health problems in our community, the people you help every day. He leaned forward. I make decisions that affect these people, but I rarely see the results. Dr. Wilson thought for a moment. Why should I help you? You fined me $350 that I can barely afford. Judge Mills reached into his pocket and pulled out a paper. This is an order canceling your fine. I found a small problem with the paperwork. She looked at the paper but didn't take it. So this is a trade? You cancel my fine and I give you a tour? No, he said, placing the paper on the table. The fine is canceled either way. It's the right thing to do. He paused. The tour is a request, not a demand. I want to learn. After a long silence, Dr. Wilson nodded. All right, tomorrow is my community day. Meet me here at 8 a.m. The next morning, Judge Mills arrived early. Dr. Wilson was already waiting with a clipboard and a bag of medical supplies. Ready? She asked. Their first stop was a homeless shelter. The small building housed 30 people. Many looked sick. Dr. Wilson checked an old man's feet, which showed signs of diabetes. He needs special care, but he can't afford it, she explained. We do what we can. Next, they visited a free clinic. The waiting room was full. Children coughed. Adults looked tired. One staff doctor and 2 nurses tried to see everyone. We're open 2 days a week, Dr. Wilson said. The rest of the time, these people have nowhere to go except the emergency room. Judge Mills watched as Dr. Wilson treated patients with kindness and skill. She knew everyone's name. She remembered their stories. She cared. In the afternoon, they went to a school for a vaccination program. Children lined up nervously. Dr. Wilson made them laugh as she gave the shots. Many parents can't take time off work to take their kids to the doctor, she explained. So we come to them. Their last stop was a small apartment building. They climbed to the third floor where an old woman opened her door. "Mrs. Parker, this is Judge Mills," Dr. Wilson said. "He's learning about our community health program." Inside, the apartment was clean but cold. Mrs. Parker showed them how she had to choose between medicine and heat last winter. "The judge here might be able to help with that new program we talked about," Dr. Wilson said, giving Judge Mills a meaningful look. As they walked back to their cars, Judge Mills felt changed. He had seen a side of his community he never knew existed. "There are so many needs," he said. "How do you not feel overwhelmed?" Dr. Wilson smiled for the first time that day. "I focus on helping one person at a time, just like you could do from your bench." Judge Mills nodded. An idea was forming in his mind. A way to make a difference. In the quiet town of Millbrook, Sarah Thompson lived a life that seemed ordinary on the surface but harbored an extraordinary secret. At 32, she worked as a local librarian, spending her days surrounded by countless stories. Yet her own tale was far more intriguing than any book on the shelves. Every evening after work, Sarah would return to her small cottage at the edge of town, carefully locking the door and drawing the curtains. Her neighbors thought her shy and reserved, but they had no idea about the hidden compartment beneath the floorboards of her bedroom. One rainy Tuesday night, Sarah opened the secret compartment and pulled out an old leather-bound journal. Inside were maps, sketches, and cryptic notes that told a story of a family treasure hidden generations ago. Her grandmother had whispered stories about this treasure when Sarah was just a child, stories that most people dismissed as fairy tales. The journal belonged to her great-grandfather, William Thompson, an adventurer who had traveled extensively across South America in the early 1900s. He had discovered something remarkable during an expedition in the dense forests of Peru, something that could change everything. But he never revealed the full details, leaving behind only fragments of a complex puzzle. Sarah had spent years decoding the journal's mysterious contents. She studied languages, collected historical documents, and traced her family's complex history. Her colleagues at the library had no idea that the quiet woman who organized books was actually an expert in historical research and cryptography. The most recent page in the journal contained a set of coordinates and a strange symbol that looked like a mix between an ancient tribal mark and a geographical marker. Sarah had cross-referenced these details with multiple historical records and satellite maps. She was close to solving the mystery, closer than anyone in her family had ever been. Her research suggested that the treasure was not just about gold or jewels. It was something far more significant, an archaeological discovery that could rewrite history. William Thompson had stumbled upon evidence of a lost civilization that predated known human settlements in the region. As the night grew darker, Sarah spread out her documents on the wooden table. Photographs, translations, and hand-drawn maps created a complex web of information. She was meticulous, checking and rechecking every detail. Her passion burned bright, fueled by years of dedication and the hope of finally uncovering her family's greatest secret. The town of Millbrook knew nothing of Sarah's hidden passion. To them, she was just the quiet librarian who loved books and kept to herself. They saw her walking to work each morning, carrying her leather bag, smiling politely but never revealing the fire of discovery that burned within her. Little did they know that Sarah was just weeks away from potentially making a discovery that could change archaeological understanding forever. The treasure her great-grandfather had hinted at was more than a material possession. It was a key to understanding human history in a way no one had ever imagined. Her fingers traced the coordinates on the map. Peru's remote mountain regions held the answer. She had been saving money, planning her expedition carefully. Every penny from her modest librarian's salary went into preparing for this journey. The rain continued to tap against her cottage windows, as if signaling the approaching moment of truth. Sarah knew that her entire life had been leading to this point. The quiet, unassuming librarian was about to become an explorer, about to solve a mystery that had remained hidden for over a century. She looked at her great-grandfather's journal and smiled. The secret was almost hers. The treasure was waiting, hidden in the misty mountains of Peru, ready to be discovered by the last person anyone would expect, a small-town librarian with an extraordinary dream.